Hello and welcome to another interesting edition of Health Watch. Recently, World Tuberculosis Day was celebrated, and this year's theme is on "The Clock is Ticking." Now, this is our major focus for today's edition. The theme conveys the message that COVID-19 pandemic slowed down, or would I say, delayed the progress of curing TB, and this has created a wide gap, in fact, a huge burden, especially on people living with TB. Now, on today's edition of we brought you an expert who is very grounded in this field. He'll be sharing with us what we should be looking at as per where we are now in terms of as regards to TB and which way forward, knowing that there is a challenge already with the pandemic. To buttress the point, we have a report on the impact of COVID-19 on tuberculosis. I'm sure this is one report that we all need to learn from. Let's see this report together. My name is Nkem Okibe, and you're on to Health Watch, reaching you on the station for excellence. Enjoy that report. We'll be right back. As we continue the fight against COVID-19, the burden of other health issues cannot be overlooked, though the pandemic has taken more attention. But we must not forget the dangers and complications that could arise if other ailments are neglected. Experts warn that if measures are not put in place to fund and control diseases of public health significance like HIV, malaria, tuberculosis, there could be a post-COVID health crisis in Nigeria. Stop TB Partnership in Nigeria says the outbreak of COVID-19 has led to an increase in tuberculosis cases in the country.
TB should not suffer because of COVID, because a lot of more people have TB than those that have COVID. This is not to de-emphasize the importance of COVID, but just to further emphasize the importance of tuberculosis.
COVID has really affected the TB program this year. I will say majorly negatively, because we have not made as much progress in finding the cases. Though COVID and TB, they have similarities, Nigeria is still missing 300,000 new cases every year. We are only able to detect 25% of the estimated TB cases.
Globally, $28.5 billion is needed to combat the 20% increase in tuberculosis, malaria cases due to COVID-19. While stakeholders commend the efforts of the government so far, they also believe the private sector can contribute their own quota.
The private sector at the moment is already playing some roles, so this can be expanded. So we need to identify more private sector partners to play a bigger role. They could do this through corporate social responsibilities, or even identify philanthropists, make them TB champions and give them awards and recognitions, high net individuals and people who can actually play a role.
However, stakeholders are asking government to create a presidential task force on TB, as this will help to curb the spread of the disease as well as reduce the mortality rate of tuberculosis.
We need a presidential task force. Now that the TB we thank God for the way that the COVID is being controlled now, it is now community. But the community cases are not coming out. And because of the opening of the airlines, there may be new cases that may come in. So for ability for the COVID program to be able to penetrate into the community, let them use our TB 12,000 drug facilities where we have officers. We need to, so that we can use that to detect. Our drug centers see a person coughing. And so if we are able to integrate them, then so the person coughing can also be tested for COVID, and it will also increase our their detection of cases.
Presently, even within the National Assembly, there was a committee that was set up in order to look at the issue of the convicts, and then even me as the chairman of tuberculosis, I'm part and passive of that committee. And sooner or later, by the grace of God, we are bringing up our report, of which, by the grace of God, we are praying that the issue of tuberculosis, with the support of the donors and with what we felt the government are doing in order to increase the budget of tuberculosis by almost 50%, we felt that by the grace of God, the issue of tuberculosis will come to an end.
It is pertinent to note that TB is a chronic disease, while COVID-19 is an acute disease. In fact, tuberculosis is killing more people than COVID-19. This is a big concern to public health. Therefore, expert stakeholders are calling on the government to intensify efforts to funding and controlling TB and pay equal attention to other diseases, just as is being done to COVID-19. If you're just joining us, the program is still Health Watch, and our focus on today's edition is on tuberculosis. With me today is a very important person as regards this topic, Dr. Adepoju Victor Abiola. He is the Director Strategic Information, USAID, TB Loan 3 Project, IHVN Nigeria, and is also a public health physician, a researcher, an expert in infectious diseases like TB, HIV, just to mention a few. You're welcome to Health Watch.
Thank you very much for having me.
That was a very long CV I just read. Okay, we watched the report together, and one interesting thing about that report is the fact that the stakeholders in Nigeria are asking for or are making a request that it would have been also, it would be good if there will be a presidential task force on tuberculosis, just like we have a presidential task force on COVID-19. But now the question is, before you get to that level, do you think people are aware of this disease, and what are the modes of transmission?
Okay, so thank you very much once again for having me. Like you mentioned, tuberculosis is a disease that has little awareness in Nigeria. In fact, about 2 years ago, there was a study that found out that in Lagos alone, just about 30% of Lagosians are aware of tuberculosis. So, and for me, that's the first step in the fight against TB, in the fight to end tuberculosis. People need to be aware of tuberculosis. We need to also learn from HIV program. The last 2 decades, I've seen a lot of awareness about HIV. Every nooks and cranny of this country, people know about HIV. They know the mode of transmission. Whether you go to school or you are literate or you are illiterate, almost everybody knows the basis of HIV transmission. So we need to learn from HIV and bring that same approach to TB program. We need to create more awareness, and we need to provide targeted messages for different populations. The way you communicate to the young people may be different from the way you communicate to children, to working population and all that. So it has to be targeted to address behavioral changes and some of the issues. So you are right, awareness is low, just about 30% in Lagos 2 years ago. Maybe it has increased now, but we need to keep using different strategies to make sure everybody knows about the basic symptoms of TB and how it is transmitted in society. Yeah.
So I don't think you highlighted the modes of transmission.
Okay, so in terms of the mode of transmission, first and foremost, tuberculosis is a bacterial infection, and it's basically spread through aerosol. Aerosol is generated when somebody coughs into the air or sneezes into the air, and that aerosol is suspended in the air. Anybody, innocent person walking around can inhale such aerosol and gets transmitted into the lungs, and that can stay for some time, depending on how strong your immunity is. Some people, when they inhale such aerosol, they can progress to disease. So when you inhale the aerosol, you are judged to have TB infection. You don't have the disease yet. You are just having infection. And that infection can stay up to 10 years, depending on the level of immunity you have. It can even just be within 3 months, you can progress to disease, frank disease, and you start having symptoms. But if your immunity is strong, you can carry it in that way for about 10 years without showing any symptoms. And when you now start having some conditions that can reduce your immunity, such as HIV, diabetics, cancer, those things can now bring that infection to flare up. It becomes actual disease with signs and symptoms. So that's basically the progression, how it is transmitted.
No, now the theme for this year is the clock is ticking. I'm beginning to wonder, was there no plan on ground before now? Because COVID-19 affected everybody, affected economy, education, even we as media practitioners. Now the question is, where are we right now? What is going on right now?
Okay, so in terms of progress in TB control, I would say for us as a country, that we are making progress as a country. In 2019, Nigeria is said to be one of the high-burden countries, 30 high-burden countries in the world that contributes 80% of TB cases, global TB cases.
Okay.
There are also about 10 countries that account for 2/3 of TB cases globally. Nigeria is number 6. The first country is India, followed by Indonesia, China, Philippines, Pakistan. Number 6 is Nigeria. We contribute about 4.4% of global TB cases all over the world. But despite that, we've made significant progress. One of the challenges of TB control is that people they have TB in the community, but they don't get diagnosed. And when you don't get diagnosed, the risk is that you keep transmitting that infection in the society. In fact, it's been found out that one person with TB disease will infect 15 persons in a year. So if you have TB and you are there in the community, you are not diagnosed, you are not on treatment, you can infect 15 people in a year. So what that means is that, so it has been estimated that in Nigeria, about 440,000 people have TB in a year. And before 2019, we have always been finding about 100,000 people out of 400,000 plus. In fact, in 2017, we have about 103. In 2018, we have about 101. But the good thing is that in 2019, there comes the game changer. Nigeria, for the first time in history, we identified 120,000 out of the estimated. We still have a lot of people, definitely, but there is a progress. We moved from around 100,000 every year to about 120,000 in 2019. So for me, we have about 20,000 extra people who could have spread additional, transmit to other people who could have also died. Because the problem is not just infection, we also have mortality. In that 2000, we have about 150,000 people that were estimated to have died from TB. So you can see that progress in identifying the missing cases. We call those people living with TB that are not found to, we call them, there's a terminology we use, we say they are missing TB cases. In other words, they are missed in the community and they keep on transmitting. So that's why awareness is important. People need to know about it. They need to know that treatment is free. They need to know that diagnosis is free. They just need to go to the hospitals, get tested free of charge, and if they are found to have TB, they get the treatment free of charge. And that we can interrupt that chain of transmission in the society. So there is progress. Progress in terms of we find more people. And 2020, the report is yet to be out. The national program is still collating the report, but we are hopeful that we may even exceed that 120,000 people that we found in 2019, despite the COVID. We'll be able to exceed that. Even though we know that Q2 of 2020, there is a very big blow on TB case finding, globally as well as in Nigeria. Our case finding, because we report every quarter, it actually dropped drastically in Q2 of last year, where COVID started happening. But we are hopeful that at the end of the day, the total we will have in 2020 will be more than what we have in 2019.
Okay, we saw the report together, and the report talked about having a presidential task force on tuberculosis. What's your take on that?
So the way I look at the presidential task force is a coordination platform, and we also need that in TB program. There's a need for the control effort to be driven from above. You know, when people see a presidential task force that has been, set up by the president, everybody will buy into it. The other stakeholders, the private sector, the public sector, they will buy into it. The community, the people, the Nigerians will buy into it because it's coming from the president. So I agree with you that they need to have that kind of coordination platform that will be giving feedback on a weekly basis, on a monthly basis, the achievement, the progress, the challenges, and how to resolve it. Another benefit I see from such platform is that it's a multi-departmental and multi-sectorial approach. You see that PTF is not just the health sector that is there. We have other sector, education sector is there. We need to create, we are talking about childhood TB cases in Nigeria. That despite even the progress we are making, children are lagging behind. We are not finding enough children. So and the education sector is very critical in this stage. We need to create awareness in schools. We need to create awareness in colleges, in primary school, in secondary school. So those are some of the things that the PTF, a coordination platform like PTF, will bring on board. The education minister will be represented here, and that can help us to create more awareness in schools. The other sector will also be represented there, the Justice Department, and some other things. We have people that have TB that are being fired from their work. So TB is not just an health sector issue. It's a multi-departmental, multi-sectorial issue. And that coordination, that response has to be multidisciplinary, it has to be multi-sectorial. So I think it's a welcome idea that will be very useful as we move ahead to end TB in Nigeria. But we also need to do those fundamental things by creating awareness. More and more people need to know about TB.
For every disease in the whole world, early detection is key. So you find that you're coughing, for the past weeks I've been coughing, I need to see my doctor. You have that assurance that, oh, there's a dot center around me. Oh, I need to get, so you need to educate us on that. What are we supposed to be doing if you come down with this infection? If you feel you've been infected with TB, what are you supposed to be doing? Where are you supposed to go to? Who are you supposed to speak with?
So thank you very much. Like you said, the access is there. Like for instance, let me take Lagos State for instance. Almost every hospitals in Lagos State can provide TB services, and we have also diagnosis for TB, which are all free. So if you go to the hospital today, they screen you for symptoms of TB. Basic symptoms, they are just 4, basically. You must have been coughing for 2 weeks or more. You are losing weight. Maybe people are already telling you, the cloth you are wearing is loosening on your body and all that. Or you have fever, or you're sweating the night. So those 4 basic things are the regular symptoms that we ask our patient when they come to the hospital. If you are positive to any of those things, we call you a presumptive TB. In other words, you are being presumed to have TB. It is when you go for tests that you can now be diagnosed. So it's like you are suspecting. You have a suspicion of TB. Okay. And the doctor will now take your sputum and send it to the lab for diagnosis. That test is free of charge, anywhere you get in Lagos.
We'll go on a short break. When we return, Health Watch continues in a moment. Stay with us. If you're just joining us, the program is Health Watch, reaching you on your #1 station, NTA Lagos Channel 10, station for excellence. And my guest is still with me, Dr. Adepoju, Victor Abiola. He is the Director of Strategic Information, USAID TB Loan 3 Project, IHVN Nigeria. And we've been talking about tuberculosis. I like the fact that you gave us, you reassured us all on the fact that TB treatment, the drugs, testing, diagnosis, every other thing that comes with it is free. Now, whoever it is that is out there and has these symptoms you've mentioned earlier could just say, oh, it's good to know that I won't be spending money to treat myself. I just need to see my doctor. I need to walk into the nearest government hospital and access this treatment. Now, going forward, what are the stakeholders in Nigeria? What are they doing right now? Because it looks like everybody's pointing fingers at the global leaders. The global leaders has failed us. It's also good you also look inwards in our country. What are you doing about the fact that you're having missing cases and then you are progressing at some point, the pandemic comes in and then you have this challenge right now. So what are you doing to ensure that we progress, we move to that stage where we end TB?
Okay, so I think I would like to, at this stage, I would like to talk about what we call universal health coverage, which is the goal of any disease control. TB, whether you like it or not, is still largely a disease of the poor. Although we have rich people also have TB anyway, because the poor will carry the rich in the car, will be the driver of the rich man. So TB can affect anybody, but we know that it affects also the vulnerable people. It's commoner among men than women. Even though less women have access to treatment, like we said, we just celebrated International Women's Day. Okay. So it's also a clarion call to provide more access for women and children for TB services, breaking those cultural barriers that may prevent women from access. So, coming to your question, I would like to talk about the efforts of global efforts, Nigerian leaders, and also the donors, USAID, United States Agency for International Development, and other donor global fund, and with the government of Nigeria, what they have been doing. I think currently, universal health coverage in TB begin to have more voice. In other words, poor people, middle class, people don't have much money. Because whether we like it or not, Nigeria as a country, most of our TB response is still largely donor-driven. Whether we like it or not, this donor will move one day. We will be left. So we need to come up with something that is more sustainable in terms of treatment and all of that. Now, donors are paying for the diagnosis with some support from the government also. Also for treatment with some support from government, but largely donor funded. So we need to start thinking about sustainable solutions in case these donors pull out. And one of the things that we are doing currently, and stakeholders in Nigeria are also making a lot of effort, is universal health coverage. Okay. In terms of integration of TB services into health insurance program. Okay. For instance, recently we just launched the health insurance TB inclusion into health insurance in Osun State. Ogun State also has done something like that. And I know Lagos State is already having Lagos State Insurance Program, and TB is one of the major things. TB testing, especially the microscopy testing, HIV testing is part of that package. So this is something that every state in Nigeria needs to look at, because that is the way to go. People need to have health insurance. We just have about 5% of Nigerian population that have health insurance right now. So government at all levels needs to prioritize health insurance for the citizens. People need to have health insurance, and TB services need to have prominent coverage in that package, so that when somebody is sick, in fact, there was a survey that Nigeria did about 2 years ago on catastrophic cost on TB. When somebody has TB, what are the costs? Because diagnosis and treatment is just one part. What about the transport that person will take to get to the hospital? What about if that person has other diseases apart from TB? So these are things that people still have to pay money for. And it was found that people pay up to 90% of their income when they have TB, especially the more deadly one that we call drug-resistant TB, which takes longer time to treat, and it's more, the mortality is higher.
So what are you doing in this context? Is there a support group?
Undergoing treatment in terms of adherence, in terms of support, in terms of economic support and all that. But it's something that is in the making. We need to scale up that in every state in the country and make it to be more effective.
Oh, very nice. It's also good to know that TB can be cured, right?
Yeah,
so you said
curable.
6 months.
Yeah.
So you said 6 months, then if there's resistance, it could take a year.
Yeah.
Now, very quickly, in just 1 minute, what's your final word to the public out there?
So I would just say that TB is real, but the good news is that it's curable, and the treatment is free of charge. So you don't have to go and sell your house or sell your land because you have TB, because everything that you'll be given is going to be free. Your test will be free. So if you have anybody in the community, it's an opportunity for you to tell that person to go to the hospital. We are in Lagos now. Almost every hospital in Lagos can treat TB, actually the public ones, and the majority of the private also can treat TB. So you don't need to go to Yaba, IDH, because that's another problem with TB. People think that it's only Yaba, IDH you can treat TB. But that's hospital close to your house. You just need to walk in there and get diagnosis and get treatment if you are confirmed. So let's create awareness everywhere we are and be able to save a life from dying from TB. Thank you.
Thank you so much for coming on the program. I know you're a very busy person. You've been in a lot of programs and I had to pull you out to come on the show. Thank you so much. We've been speaking with Dr. Adepoju, Victor Abiola. He is the Director of Strategic Information, USAID, TB Loans 3 Project, IHVN, Nigeria. And that's it on this week's edition of Health Watch. Remember that health-conscious people live longer. I love the fact that the doctor talked about that TB can be cured, so you don't need to be scared anymore. Please come out from that your hiding place. See your doctor. The treatment is free. The test is free. Every other thing that comes with it is free. And interesting to know that you could also find a support group that will also encourage you in this time. All right. If you have questions, you have inquiries, please send the mail to okibenkem@gmail.com or ntalagos10@gmail.com or send a text only to 0706086547. My name is Nkem Okibe. See you next week.